Hi, my name is Alicia Carmack and I'm going to be doing my assessment on Jacob. My advanced assessment today is on the lymph nodes, the thyroid, and also the abdomen. Jacob, I'm going to go ahead and feel your lymph nodes, starting at the back of his head at the occiput region, and then feeling his post-auricular, his pre-auricular, his tonsillar, submandibular, submental, superficial cervical, posterior cervical, and also deep cervical, and then supraclavicular. The supraclavicular lymph nodes can also be assessed by having the patient slightly shrug their shoulders, and then you can feel within. I'll also move into the thyroid. The thyroid assessment can be done from in front of the patient or behind the patient. Starting with the patient's chin here, we go ahead and find our landmark. So I'm going to slide my hands down the patient's Adam's apple, and then over the rough process, the cricoid process of the Adam's apple, and then sliding my fingers on either side of the trachea. Just below that are the lobes of the thyroid. We'll have the patient swallow, and then from behind of the patient, again, also getting your landmark of the chin, sliding your hands down the trachea over the Adam's apple here, the cricoid process, and then to the side of the trachea, feeling the lobes of the thyroid, have the patient swallow. And then if the thyroid was enlarged, we would go ahead and utilize our stethoscope to listen. For the abdominal assessment, we'll go ahead and have Jacob move back on the exam table. So for the abdominal assessment, you want to have the legs of the patient slightly bent, have their arms down to the side, and then at first you just want to inspect the abdomen. You want to look at the abdomen while the patient breathes, checking for any pulsations, any hernias. You also want to check to see if you see any scars, any masses, any lesions, and then from there you want to go ahead and listen to the abdomen. You want to listen to at least 4 of the quadrants, the diaphragm of the stethoscope. You're listening to see if there's any hypoactive bowel sounds, any hyperactive bowel sounds, any absent bowel sounds, and then you're also comparing them to the quadrants. Then you want to move into the pulses of the abdomen using the bell of your stethoscope. You want to go ahead and listen to the aorta. And then you want to move your stethoscope and listen to the renal. You want to listen bilaterally for any bruits. Then iliac. And then to the femoral. You can also do the femoral when you do that side. When you actually move down into that region, I should say. Again, listening bilaterally. Then you want to move into percussing the abdomen. You want to percuss at least 4 of the quadrants. Checking for any tympany resonance, any areas that could be gas filled. Then you want to go ahead and percuss over the liver. The liver should be at least 6 to 12 centimeters. And then you want to go ahead and lightly palpate over the liver. And then the spleen. And then bilateral kidneys. So since I'm on this side, I'll start with the left. And then you want to go a little bit deeper. So we'll go back to the liver. And then the spleen. And then the kidney, and the right kidney. And then the last assessment that you want to do is go ahead and check the abdominal aorta. And then from there you want to have the patient lower their legs and then slightly sit up, so almost like they're doing a mini sit-up, so you can assess the abdominal muscles. And you can go back down. And then you want to use the base of the hammer and you want to slide it across the patient's abdomen, seeing if the abdomen tenses up or the skin kind of wrinkles up at all. From there, you want to go ahead and move into the femoral and inguinal area. So we would want to feel for the femoral pulses, as well as feel the inguinal lymph nodes. And you want to do this bilaterally. And then this concludes our abdominal assessment. My name is Alicia Carmack, and I'm presenting this from Maryville University. Thank you.